So I'm Dr. Jillian Doyle. I'm a clinical psychologist here in the Rotunda with the Perinatal Mental Health Service. So we offer support and interventions to women experiencing any sort of mental health difficulties or challenges during their pregnancy and up to 1 year postpartum. If you're experiencing fear or terror or any sort of anxiety about giving birth, I suppose the first thing I would get you to do is have a think about what are the kind of things that are making you feel anxious, and just jot those down for yourself. So you're trying to identify what exactly am I terrified about, and then try and notice what are the emotions that you're feeling in relation to your fear. So just checking in with yourself about your anxiety. Some of those questions you have, you might be able to bring them to your midwife or to your obstetrics team, and they might be able to answer some of those questions. So some of them might be fact-based kind of questions that you're just worried about. You might find that you're doing some behaviors that actually aren't helping you. So sometimes if we're very frightened of something, we might end up trying to seek answers from places where those answers mightn't be as helpful as we think that they may be. So for example, if you're Googling things that you're frightened of, sometimes Google will give back really good answers, but sometimes Google will give back answers that actually heightens your fear. So if you think that you're engaging in some behaviors that are escalating your fears or making it worse, try to reduce those fears. Likewise, sometimes what happens is that people in our lives end up telling us stories about their own births, and sometimes those stories can feel really validating, but sometimes those stories can actually make us feel even more frightened. So if that happens for you, if someone is telling you a story which makes you feel uncomfortable, it's okay for you to say, actually, I don't really want to hear that, or, you know, I'd rather if you didn't go into that sort of detail. If the fear continues and if you feel that it's affecting your daily life, so if it's stopping you from experiencing pleasure or if it's stopping you from socializing, well then, you know, you might consider contacting the mental health service in the hospital. And we've got lots of different services to support women who are feeling frightened of giving birth. There is a mental health disorder called tocophobia, which is a fear of giving birth. And some women may be experiencing that. And if that is the case, you know, there's lots of treatment out there that we can do to help support you through the remainder of your pregnancy and through the labor, so that you'll be feeling, you know, positive and empowered as you go to give birth.